So a few weeks ago we did a story on the oscillating drill. It's a type of drill that oscillates as opposed to rotates, so it's supposed to be less traumatic on neurovascular structures such as the spinal cord, the dura, the nerves, and the blood vessels. So today we're trying it out on a trial basis at the hospital. We have 2 days. We're doing 9 cases. Usually try to stack these cases up in trial. So we're going to see how it works. One of the most important things with drills are tactile feedback. The other thing is that because of the oscillating technology, it's supposed to create less heat, and that's supposed to be safer from nerve root injuries, which are a lot of times related to heat. So the first case today was a cervical fusion. As you can see, the drill tip is kind of a barrel-shaped drill that increases the surface area for contact across the bone. So you can see on the illustration, it gets through the disc well. One of the drawbacks, though, is you can't really pull out. For deeper disc space, you're not able to get in, but it did do a good job in terms of getting through. It increased my speed, I think, a little bit, and it didn't really seem to get hot. I think you can see on the picture here that it seems to be kind of getting through the disc and the bone quite well. So our second case was a lumbar interbody fusion, which means that we put a implant into the disc space to take the place of a collapsed disc in a patient who had some spinal stenosis and a recurrent disc. So it worked well for that. The biggest thing I think with the laminectomy particularly is the tactile feel wasn't as strong as what I'm used to with the drill. That could be because I'm new to it too. One of the cool apertures is this drill brush here that's meant to decorticate or kind of clean out the end plate and remove the disc, which I don't normally use. I don't normally have to see with this traditional drill system. So again, normally I wouldn't put a drill bit into the disc space, but here, because of the safety profile, you can do it. So finishing up for the day, as I said in the beginning, I did a total of 9 cases there. Overall, the oscillating system worked pretty well. I mean, I think it was safe around the nerves. I think it definitely seemed to dissipate less heat than the traditional system, which I think was good, particularly at sensitive nerves like C5, 6. There were 2 cases where I reverted back to my old drill bit. One I alluded to was a case involved a cardiac rhina. I just wasn't totally comfortable with the tactile feedback, and I didn't want to risk causing an injury. Another case, a minimally invasive tubular case, and the tube was too long for the apertures. One of the drawbacks here is because it's a newer system, they don't have longer tubes for bigger patients or where you have to go through a tube. I had to kind of go back to a regular drill system because I was worried about the length and I didn't want to push down too hard. So I think like with any new technology, I think it does have promise. I think there's obviously modifications that need to happen, and like what people talk about with anything, like even AI, it's a gradual incorporation into practice. I think there are going to be pros and cons, and you kind of see how it fits into your overall mode.